Thank you, Kathy. It's a privilege to be joining you all today for this session on the impact of the pandemic. Can we have the first slide, please? So it is clear, as Adrian's highlighted, that wherever we are in the world, every aspect of our daily lives has been impacted over the last 2 years. The impact has been different in different countries, but that still remains the case. Next slide, please. So last year, we started the CIICA conversation series, where we have brought together people who are interested in exploring a current issue in a small group. And the very first topic that we looked at was the impact of the pandemic back in October last year. And we're delighted that we were joined by cochlear implant users and service providers from 9 countries. And that included Canada, Ecuador, India, Iran, Finland, Slovenia, Sweden, Turkey, and the UK. And the aim here was to share our experiences. And we took the time to explore what we have had to rethink during the pandemic, what approaches we have taken to the different challenges that we have faced, and crucially, what we have learned that can help us now and in the future. So my aim in the next few minutes is to bring out the main themes that came out in that conversation. Next slide, please. So for users, and we will hear more about this from other speakers later, some of the key issues faced were inevitably masks, getting used to different technology, and the real challenge of access to services. Now, the group did report some real positive impact on deaf awareness during the course of the pandemic, as more people were able to learn about how many people use lip reading, some of the challenges that masks were bringing. In Slovenia, for example, a law was introduced to enable people to use face shields instead of masks. Everybody talked about the challenges of all different types of face covering, and that clear face masks, as an example, have taken a long time to reach services, if at all. Now, the use of video conferencing tools with caption and translation that has continued to improve over time has been particularly beneficial, along with the ability to be able to use lip reading, speech reading through online platforms. And people of all ages have become far more confident in using technology. And this has also enabled cochlear implant users to connect well with friends, family, education, and the workplace. But we also talked about how many people still feel isolated and had in fact had increased isolation due to extended periods of lockdown in their countries. And the group shared the real underlying concerns of the long-term impact and the short-term impact on mental health. Now, across the countries who were represented, there was a real shared concern about the growing waiting list for surgeries for both adults and children. Adrian has highlighted some of the statistics from the UK, but this was a very common picture across different countries. Surgeries had been stopped or they'd slowed down in several countries, and referrals were not coming through at the same rate as before. And one of the biggest learnings that we've seen from the pandemic so far that we talked about was the delivery of remote services. Services have had to adapt, and there have been many, many positive developments that we must build on going forward. People have become more confident in the use of online services. They've made new connections. For example, the number of members in online support groups had really increased in Iran. This was similar in other countries. Families have been able to join more online groups and draw on support from new and different sources. And that's been really important in this period. We've also seen that some services have made savings for their services for organizations and individuals, such as travel time to centers. Services have developed new ways of working, remote programming, supporting upgrades, and service users have increasingly been trusted more to manage their own technology. And crucially, remote habilitation support has become more widely available through telepractice. Now, many of these different ways of working were in their infancy prior to the pandemic and only available on a really limited scale. But it's been really, really encouraging to see the very positive responses from families and adults here in the UK to having different sessions through online platforms. Now, at the charity where I am in the UK, Audrey Wellbeing UK, we've undertaken research and we've seen that more families who were following an auditory wearable program were choosing telepractice or a mix of telepractice as their preferred option for working with specialist support. And we were also seeing that the outcomes were consistent with face-to-face delivery. But there are many children and adults around the world who have not had access to remote or face-to-face support. And a very real concern from those who attended our CIICA conversation was that new cochlear implant users may not be reaching pre-pandemic outcomes. There are many who do not have technology at home. Wi-Fi may be inadequate, or online platforms may not be available. And there are some very, very real challenges for many people in accessing remote services. So it's really vitally important that we learn from what has worked well in different countries and how different service providers have overcome those challenges. And crucially, we need to stay focused on the outcomes that we're trying to achieve. And as Adrian was talking about, this requires us to think differently. At the start of the pandemic, many of us who provide services were striving to replicate what we would be doing in our centres, face to face, when we went into lockdown. We needed to be able to adapt. We needed to be flexible. We needed to try new things. Some things worked and some didn't. And remote habilitation is a good example of that. Just to explain, say, delivering speech and language therapy online requires us to think differently about how we achieve the outcomes using the technology at our disposal. For children, how we're coaching their parents and carers online and maximizing a session with them whilst they are in their home environment. It is not simply trying to replicate what we might do if everybody was in the same room. Because when we think differently, but keep focused on what it is that we're trying to achieve, we open up new possibilities and new and improved ways of working. Another example that's really good is support groups and how effective they have been during the pandemic using online platforms. And that was something that was shared across many members of the group in our conversation. So hybrid models of working and delivering services are now emerging in different countries, recognizing the benefits of both remote and in-person service delivery for users, for staff, and for organizations. And I think there's so much that we can learn from each other. The final area that we discussed in our CIICA conversation was the impact of pandemic debt, which leads to huge challenges for the funding of cochlear implants and services worldwide. Services who rely on charitable giving have also been hit hard in the pandemic globally. And in the past, this has been a real route for providing crucial extra services for families and adult users. So we discussed the need to renew the spend to save arguments, to update them, and to update the resources that are available to all of us worldwide. Final slide, please. So in summary, the pandemic has affected all of us in similar and different ways, and it continues to do so. And it's what we do now that is crucially important, because we need to build on what has worked and not just try and return to what we did before. It is a real opportunity for service providers to think differently about how we achieve the outcomes that we all want to see. It is a real opportunity for cochlear implant users to influence what it is that we want and what works for us in a new normal. We know that there's far too many children and adults around the world who have limited or no support with their cochlear implant for some time. And we know that there are far too many who could benefit who are not yet able to access surgery or support, or as Robert was talking about, do not even know what is possible. So there's never been a more important time for advocacy. And that's why events such as today and the work that we do together across the CIICA network in our own countries is so important. So I'd like to thank all the participants in the CIICA conversation for sharing their experiences. If anybody wants to contribute further to the conversation after today, you can do so on the website. And you can also find details about future conversations and suggest any areas that you'd like to discuss in a future CIICA conversation. And we do hope that you will join those that you have interest in. Thank you.
Thanks so much, Anita. What broad areas and the benefits and the tough situations have been covered in those CIICA conversations. That you can obviously go quite into a lot of depth there. Brian, any comments in the chat?
Yeah, I think people just pointing out that, of course, we have to be aware that the kind of COVID bill, if you like, and the COVID debt is huge. And I wondered, Anita, if that makes me think even more about a constant theme from CIICA about how we actually therefore demonstrate that actually creating more access for cochlear implants is actually going to deliver savings in the longer term rather than expense. But it's a difficult argument to get across at the moment. I wondered if you had any thoughts about that.
Yes, I think it's really thinking about all the different ways that we did within Spend to Save and the different aspects and impact on quality of life. And there's so many areas of published data now that I think we have to be able to align that to the particular ways that governments are thinking at the moment in relation to levelling up, and use the data that trains, so for example, around mental health and those areas where we actually can demonstrate a real impact and why the investment is so important, particularly in the early years, because you can see the long term and those studies that have happened like that with colleagues in Australia. And if we can harness that collective knowledge across the network, I think that we pull up where those real strong areas of data are that can help all of us with our advocacy.
Brilliant, thank you.